This video is an account of all of Steve's ailments leading up to his terminal cancer diagnosis. Hopefully it will give you a good idea of what he's been through before we start our carnivore journal. So basically what I wanted to go through was all the things that you've been through in your life as far as medical issues are concerned, right from the beginning.
Well, from the beginning. I was born with a condition called Hirschsprung's disease, which is a disease of the lower bowel. It's quite well recognised nowadays, and the treatment for it is a bowel transplant. Back then, that wasn't even thought of, and the surgery was quite experimental. So from 1959 to 1961, 6 major surgeries on my abdomen, and a portion of my lower bowel was removed and stretched to fit, and that held it at bay, but it did cause a stricture where you've got an unnatural narrowing of the colon, which means from then on you find it difficult to do normal daily things. Yeah, it was quite a horrendous thing, so I've been told. Luckily I don't know anything about the initial parts of it, but yes, that was my start, and accelerated on from then.
Are you willing to show your scar?
Yeah, I can do. It's yes. And there she is. 6.
It's a bit like the elephant man on your tummy.
Yes. 6 surgeries, with surgery in its infancy. Mm-hmm. Stitches and clips. And nowadays, obviously, they look at the cosmetics of things and try to make things as tidy as possible. But back then, it was just a case. That was just a case of saving your life.
Mm-hmm. Which I'm awfully grateful they did.
Yes, and it did.
Moving on.
Yes. Recurrent trips to hospital on a regular basis, all the way through my early life. Everything started to calm down a bit by the late 60s, early 70s, and then there was an unfortunate incident where there was I can't remember exactly whether it was a playground incident or a fight, but I had a testicle pushed to where it shouldn't go, and that was picked up during a routine examination, and for some reason it couldn't be teased out of its place, and so that was removed. No great loss. People can survive perfectly well on one. That was no problem whatsoever. I spent on and off during that time lots and lots of trips into hospital for just checking and trying to stabilise all my bowel behaviour. There was one admission in 1970 where I was admitted to hospital for some checks and tests, and I was in there for 8 weeks. It transpired later that I really should have only been there for about 2 weeks, but the hospital made a mistake and sort of forgot about me a bit, so I spent 6 weeks in there longer than normal. During that time, they thought things like Senokot was a good bowel regulator, and I was pumped full of that. Only later in time did they discover that you could actually overdose somebody in Senokot, and I suffered with that. But that was 8 weeks of being woken up at 6 o'clock every morning for a washout of your lower bowel, where you would be pushed into a room and some lovely nurse would these are the old days, a rubber hose and a tube and a funnel, and they would pour a gallon of soapy water basically into your lower bowel.
Some people pay money for that.
I know they do nowadays, but then it just didn't have the appeal of that. So yeah, that was 8 weeks of that, and eventually I was released and just went back to life as normal. It's an interesting interlude. The next major, and really quite a major thing, happened in 1974, latter part 1974, early 75. I just started work. I was working as a mechanic at a garage. I started to get some pains in the lower abdomen. The doctors were called. Nobody could quite work out what it was. The doctors were out to the house many times. It's got more painful and painful. And one day I got home from work basically on my hands and knees with this pain that was happening. Got in through the front door, threw up all the way down the hall. All that type of behaviour. Doctors were called again, couldn't work out what it was. As luck would have it, I had a routine appointment at the children's hospital. I was still under them at then, just for a routine check. And while I was having the routine examination, all I remember was the doctor doing the examination cleared the room, because there was lots of students in there at the time, and made everybody leave but him. It was only my mum that was there, and told her what had happened was, over a period of time, the blood vessel coming down the spermatic cord that feeds the testicle had twisted. It's called a torsion. It's quite common, but if you get onto it quick, you can fix it. And it had been left too long. Doctors had missed it. And what was happening to me was the testicle was turning gangrenous, and I was being slowly poisoned. I was in surgery within an hour, and they had no choice other than to remove that one as well. So from that point, obviously, I was sterile, and that was that. You have to get on with your life. I remember waking up from the anaesthetic, and there was my dad had actually come up, and there was the surgeon there, and there was a couple of mates. It was Paul Cooper and Steve Foner made the trip up, and they were asked to go into another room, and they broke the news to me that I would never become a father. So that was an absolute great start to 1975. But eventually I recovered, went back to work, and carried on. Various trips to hospital for checkups and examinations and stuff like that. I had a unfortunate. I don't know how this happened, but apparently it's quite common in African countries. This must have been, I think, 1980 something. The dates are a bit hazy, but a parasitic infection of the eye, and that manifests itself by you getting blurred vision, and you're constantly blinking, and you get this sensation that something's crawling around over your eyeball.
Yeah.
And the reason for that is because there are things crawling over your eyeballs. So I went to the Bristol Eye Hospital, and I had some photographs taken there for some sort of news thing that they were doing, because it was so uncommon in this country to get this, that they wanted to make a little bit of a feature about it. And of course I didn't mind. I just wanted to see properly again. The treatment for that's absolutely magnificent. I could recommend that to anyone. You're strapped down in a chair, and they very, very delicately, and fair play to them, they paint the base of your eyelashes with the same preparation that they use to treat hair lice. So the smell, the stinging is something to be endured, really. But that is the only way to get rid of it. It's sort of like lice, but on the eyelashes, and that was quite fabulous. Anyway, that was a quick fix on that one. Never found out how that managed to occur, but there you are. That's just another small hurdle. Oh. All sorts of little bits and bobs. I've had various injuries and stuff. I've broken parts of my body. Broke a couple of ribs training for martial arts. Fallen off a couple of motorbikes. Nothing dramatic. The main big hit came in the early 2000s, when I was working quite a lot, a warehouseman, working long hours, 16 hours a day sometimes, trying to make the deadlines, and I was becoming tired. Every day I'd get home, the minute I touch the settee I'd be asleep. It was just this lack of energy, but you find it from somewhere when you have work to do, when you have a job to do, and people to look after, and all that stuff.
People like you do.
I was a team leader, so that's what I do. Eventually, it became. I had a break. I think we'd finished the end of a major financial quarter, and it was easy to get some time off. So I booked an appointment with the doctors, and I was fully expecting to be diagnosed as anemic. Blood tests obviously done. I had one of those rare experiences where I got a phone call from my actual doctor, Dr. Matheson, one of the best GPs I've ever come across, and asked me to pop in and see him. I thought, well, that's a bit hard. Anyway, did. Went in, he said, he sat me down and he went, well, with this blood test, he says it's brought up something which we normally only see if somebody's got quite chronic liver disease. I went, oh. One brilliant surprise. I've been a bit of a naughty boy in my past, and I still drank, and some people could say to excess, but in the area where I was and the people where I was around, I was below average. But all that needed was another blood test, because they detected antibodies that are usually present when, but they obviously needed to prove it. So more blood tests. Another week later, I was asked to pop back in again, and they said, right, we've confirmed the antibodies in your blood, and you do have hepatitis C. I went, oh. And then there was an interesting conversation where the doctor says, do you drink? And I said, well, yes, yeah, a bit. He says, will you stop? I said, well, yes, yeah, when? And he went, now. I went, oh, okay. What do I do now? So just no drinking. I was referred then to the hepatology unit at Bristol. It took about a week or so for the appointment to come up. Went up. Yes, they confirmed it, diagnosed it, did a scan. And what happens with liver disease, liver is a remarkable organ. It can regenerate itself if it's in good condition, but at that point, because I basically ignorant and ignored things, I'd had enough with medical things and hospitals, so twinges and pains I didn't really bother with. But apparently this thing had been in my system for quite some time, and by the time it was picked up, the damage basically was already done. The liver was in a fibrotic state, where it had become tough and leathery, and a part of it had developed into cirrhosis. There's some training that goes on to prepare you for the medication that you're going to have and the life you're going to have after that. And for me, it was 12 months of interferon and ribavirin treatment, which basically, I think it breaks you down into your small component parts and rebuilds you back together again without the virus. So that was 12 months. You give yourself your own interferon injections, and you take ribavirin. They automatically put you on antidepressants because the medications can cause you to misbehave and slide into melancholia and aggression. So that's treated. They even enroll you onto mandatory anger management courses. But 12 months of that treatment, it's quite a thing.
Just a minute. Either way, he worked the whole 12 months.
Right. And I became very ill as a course of the treatment. So not only have you got the hepatitis C trying to carve you up, but the medications take you to bits as well. I looked so ill at one point that the HR director was thinking of just laying me off on permanent sick leave, because I was obviously looking not very well, lost a lot of weight, lost a lot of strength. I had to have the odd day off. During the early part of that treatment, obviously when your immune system is really quite well compromised, I had another beautiful incident where I got a hair at the top of the cleft of your buttocks grew inwards, and I developed what's called a pilonidal abscess. I could feel a little bit of pain and discomfort there, but within an incredibly short period of time, the abscess grew, and I couldn't sit down. Standing up was a pain, so I dragged myself down to the hospital in Weston. There was a queue for the emergency A&E, and I was there too long. I couldn't stand it anymore and went back home again. The next day, I got an appointment with the GP, walked in, showed him this thing. I was back in hospital within an hour and a half, and they performed emergency surgery on it, because it was just a huge mass full of poison, and it needed to be drained.
Men, this is what you get for not going to the chuffing doctors when you feel a bit poorly.
Yeah, so I had surgery for that. I had a rather frightened member of the NHS staff, just a young student nurse, as I was being pushed on the trolley to the operating theatre. She was telling anybody that came out of a side door that, oh, stand back, this patient's got hepatitis C, which I thought was a bit much, but
Crikey.
yeah, so that was a bit weird, but I didn't hold anything against her, because it's a scary disease. You don't want it.
Please tell them what your dad did when you went round and told your mum and dad that you had hep C.
What did he do?
He went out and got the gloves.
Oh, yes. Yeah, it's a wicked sense of humour in my family. So when I first went round to see them after the diagnosis, I'd already phoned them and told them bits and bobs about it, and the old man met me at the door wearing rubber gloves, an apron and a mask. I did explain to them how you get this disease, but yeah. So that being done, I was then released, and what happens with a pilonidal abscess is the hole that it leaves is so big that it can't be stitched back up in the normal way. So what happens is every day for a month, a district nurse will come and remove all the wadding out of this hole at the top of your backside, and throw it away and repack it with fresh wadding, which it's in the form of a dried seaweed. I have to admit that pain's quite horrendous, and I did break the arm of a sofa that I was on while she was doing this, because you grip. I did learn later on to take lots of tramadol and stuff like that an hour before, and that used to take the edge off it, but it really is quite painful. After a month treatment like that, the hole had shrank down, and it could be left just to heal naturally. But in the early stages, there's no stitching that will cover that size of wound. So we've got that out of the way. Of course, hepatitis C that doesn't kill you. There is a thought process through it that you never die of it. You die with it. So with it comes a whole host of other associated illnesses and things that you have to live with. It is more than likely to give you a condition called duodenitis, which is an inflammation in the duodenum. I have that. Another little intestino problems. In between that, over a period of 6 years previously, because of Hirschsprung's disease, I also suffered from IBS and quite dramatic trap wind. By the trap wind dramatic, I mean such agonising pain that you're taken to hospital. And I was admitted to hospital 3 times with obstruction in the bowel due to air. And yes, I've never been more grateful for the morphine during that. That is a horrendous thing to happen. But yeah, about 3 instances of that, emergency admissions. 6 months into the hepatitis C treatment, there was no show of the disease. All appeared to be going on the right track. And definitely at the end of 12 months, it appeared to have disappeared. But you obviously go for regular checks, and 6 months later, I was told that it was back. Apparently, it travels around the body and can hide in the fluid that gathers around your brain. And this is obviously what mine did. And then when he thought the coast was clear, it popped back out again. So, and it's not a question of the treatment starting all over again. The treatment for this is about £250,000, and it's not given out lightly. And under the NHS, you get one go at it. So, I was floundering a bit. The hope is that you could get put on some sort of new drug clinical trial. And of course I put my name up for that. Missed out on a couple of trials, but about a year, 18 months later, a slot came up to try a new drug. This was with interferon, also ribavirin, but this new tablet-based drug which you took at the same time. This course was only 6 months, and by now the injections are developed where they were delivered by a sort of an EpiPen type of delivery. 6 months of that. Didn't suffer quite as many side effects this time. I think I'm getting used to it by now. And yes, all tests after that revealed that hepatitis C had been completely eradicated. I got rid of that one.
What did that leave you with? What were the side effects that it left you with?
Well, a compromised immune system. A couple of weeks after I finished that treatment, I got psoriasis, a skin condition, all over my hands and feet. My skin would be literally absolutely falling off and red raw.
You could barely walk.
Yeah, that. But yes, that happened. It can't be directly pinned to the treatment. All I can say is, it wasn't there before. I never suffered from psoriasis, but after the treatment ended, it attacked me big time. A minor inconvenience on the scale of things, but
well, not really. You could hardly walk, and you couldn't hold things.
Yeah.
That's a fairly large inconvenience.
It's inconvenient, but it's not
compared
death.
to having Hep C, obviously, but it still was incredibly unpleasant, wasn't it? Yeah, and that was, what's that now? 5 or 6 years ago? Is it more than that?
It's more than that.
How long ago was that?
10.
10 years ago, and you were still having to put cream on your feet right up until yesterday.
Yes, right up until yesterday, when it appears to have dissipated. Now, apparently, it can do this. It can disappear or reappear at will. Stress is a big point of it. And although I didn't believe I was stressed in any way, well, obviously I was. I was just pushing it to the background and ignoring it. And of course, having the perfectly reasonable belief that with all this going on, I'm a bit entitled to be stressed. I've earned it.
Yes.
But it was a little matter.
Mm-hmm.
But apparently, if it's churning away inside you without release, it can do some strange things to your body. Right, so we get that out of the way. Everything's bumbling on a bit quite nicely. I do then later get the tooth problem that we had when we were driving to Albany, if you remember. That required hospital treatment when I got back to emergency remove a couple of teeth.
Because this whole thing damages your teeth and the calcium. You don't have enough calcium. It
does suck the calcium out of your body during the treatment. I have, I can't remember what it's called, disease, I have osteopenia, and now it's starting to develop into osteoporosis. It's because of the calcium sucking properties of the treatment that you have. So even today I'm still on calcium supplements and vitamin D supplements for that. It's had that. One particular batch of toothache was quite interesting. I went to the dentist, prominent toothache, did a couple of x-rays, and none of my teeth were compromised in any way. The pain must be coming from somewhere else. So I was referred to the neural centre at Bristol, and they did some scans, and they found that the trimengial nerve down the left side of my face was being pressed upon by a vein and causing something called trimengial neuralgia, which is also known as the suicide disease, because you feel as if you've got permanent toothache all the time. Course of drugs on that, which I'm still on today, keeps that nicely at bay. Only very rarely does it flare up and cause distress, but I can live with that. That's I hope it doesn't get any worse, but it shouldn't do. It's got to fight for its place in the queue. So that's all dealt with by drugs. There is surgery, but I don't want to go under the knife again unless I can help it. Let's just layer everything with these are little things.
Well, compare the little things.
Compare the little things which almost everybody can experience. I do suffer terribly from tinnitus, more so of an evening. Bit of a pain if you're a music lover like myself. I am going slightly deaf in my left ear due to a blockage in the extrication tube, which I can clear with seawater spray and various other things, but that is an awful thing just to have to go through. But eventually, if you persist in it, if you spend long enough washing out your ear ducts, you can hear quite well. I can actually feel it now. My the deafness is quite uncomfortable. So tinnitus and deafness. Don't know how that happens. I am getting on a bit now. 65. Yes, you get arthritis, both knees, both hips, and this thumb is worse. A couple of toes. That gets quite uncomfortable. Some days I can't climb stairs. Some days I'm up like a gazelle. I've been for several x-rays and stuff like that on them, but there's nothing really they can do. I'm getting old, I've got arthritis. I've either got to wait for my place on the knee replacement charts or just live with it. What?
You shoulder.
What's the matter with that? Oh yes, and I've got.
What's the matter with it?
I've got a frozen shoulder as well, which means reaching for anything up high, which I have to do that quite a lot. Yeah, that's quite agonising. And if ever I was arrested and they tried to force my arms behind my back, I think I would probably just let them kill me. That's the type of pain you get with that. But obviously, if left to my normal devices, I'm not going to reach past the pain zone. So that's as difficult as it's coming. I've got a few treatments coming up where I have to lie in a tube with my arms flat back over my shoulders for 45 minutes. Not really looking forward to that, but the opportunity doesn't have a great deal of appeal. Only very recently, as when I did go to the doctor for lower back pain. Oh yeah, I forgot that one. They have punted the fact that it could be a condition called cauda equina syndrome. I've now had x-rays and scans on that to see whether or not the doctor's thought process is correct, but I haven't had the results back for that yet. To be quite honest, I'm not in any hurry. We'll leave that one on the back burner. Apparently it can be quite a condition, but I haven't looked into that one very much.
Well, you've had everything else. Your bingo card is nearly full.
Yes, yeah, the bingo. Ding ding. So there's that. If you slot in between there, I've had a couple of bike accidents. One I impacted on my right side, one on my left side, which obviously didn't do my knees and my hips any good. I've been fortunate enough never to actually break anything because I'm dumpy. All I've ever suffered is severe bruising and shock and minor injuries, really. Oh, I did lose a tooth with the first one when my head bounced off the windscreen of the car. But apart from that, the injuries from that have been all quite minor.
But they've left you with a bit of a legacy, haven't they?
They have left me with a legacy. I have got, the aches and pains. Any motorcyclist will tell you if you've had a hard whack or broken anything, it does pop back later on when you think you're comfy, and will haunt you in the most painful way. During this, obviously, you go through the same illnesses that are going round, your measles, mumps, all those as a child. I get colds and flus of the winter. COVID, I tried desperately to ignore, having worked out that, it is a very, very serious and severe bout of cold and flu, which could kill you, especially if you were in a weakened state. I was put on every at-risk list known to man, but I never agreed with the way that we were locked down and face masks and things like that. I believe that it was a sledgehammer to crack a nut. But obviously we were forced to go along with as much of it as we were forced to. But every opportunity there was to not wear masks and go into areas was taken. I mean, I thought the response to it was too heavy-handed, and I should know. I am supposedly at risk and vulnerable. Let's bring it on to the present day, and
well, isn't it?
a year ago. Always when you have liver disease, especially cirrhosis, which is what hepatitis C left me with, there's always the possibility of liver cancer with the state that your liver's in. And I've always had areas in the liver which were below 1 centimetre in diameter, which the team there kept an eye on. And at some point last year, I have regular scans, 3-4 a year, just to monitor this thing. The The small area had become a larger area. Now it was an area of concern that they wanted to do some intervention with. Again, tests and scans were carried out, and it was confirmed that it was liver cancer, or what they call HCC, which is hepatocellular carcinoma. There are different types of liver cancer. This one in particular is quite aggressive. But there was a treatment for it called ablation. So basically, you're in anaesthetised keyhole surgery, and basically they microwave the area from outside your body with a probe. Unfortunately, it was placed too closely to a major blood vessel in the bile duct, so they couldn't get all of it. But they did whittle it down to a size. So while waiting for the results of all that to happen, I was at work, and I came over and I felt really, really ill, and I had all the symptoms of a heart attack, and I was taken to hospital, and I hadn't actually had a heart attack. My heart attack's actually in good nick, which is sort of bad for me in a way. I'll come to that later. They diagnosed a stress-related incident. I don't know where that came from, but it did, and it was enough to hospitalise me, only for a day. But after some time off, I came back to work. HR where I work at Oxford been very, very good. They created a new position for me in the company, which was less stressful, as a specialist and advisor. And I've been doing that ever since, and that's where I am now. Regular scans, obviously, after the ablation surgery, and we get a couple of weeks ago the news that another tumour had appeared. This one's quite an aggressive little devil. It was 3 centimetres in diameter when it was first picked up, and in between that being picked up and me being called back in, that was a month, and it had grown by another half a centimetre. So something obviously needs to be done about this. All the way through this has always been a possibility that one day I would need a transplant, or a resection. A resection is where they cut off part of your liver, throw it in the bin, and the good part left behind is used to just power you. I've got compensated cirrhosis, which means that my body and it compensates for all the defects, and it can function, not normally, but it's enough to keep you going. So I'd always favoured a resection rather than a transplant, because with the transplant you are on anti-rejection drugs for the rest of your life, and it can weaken you to a state where basically you can't do a great deal. There's a lot of people bounce back from a transplant, and they're hiking Ben Nevis after about 5 days, but I probably wasn't going to be one of those. So I didn't really want a transplant, and was talking with the medical team as to whether or not a resection would be possible. All my data and images were sent up to the London Free Hospital, who are experts in liver disease and problems, and they had looked at all the scans and that, and I was being prepared for admission. We talked about the mechanics of that. Basically, the NHS is very good. They will taxi you there and back, and they will provide your next of kin with a place to stay while this is all going on. And I was getting prepared for that. I wasn't expecting a call from the consultant a couple of weeks ago asking me to pop up and see him quite urgently, which I did, and sat down and said basically the tumour has grown too fast, too big, it's impacting major blood vessel yet again, and it was in such a place that all offers of surgery have been withdrawn. So that was a bit of a shock, which obviously then prompted the question, okay, what's next? What's next in the next few weeks is a radiotherapy called Sabre, which is it's quite a recent treatment. It can be quite effective, but also quite destructive. I have my first appointment on Wednesday for training and familiarisation. You have to be prepared for this. You have to lie in a certain way. You have to breathe in a certain way, and you have to hold your arms in a certain way. Otherwise, they could zap parts of your body you don't want zapped.
And you've not got much left.
Not got a great deal, no. Not that it's been any good. So that's all on the card. So this Wednesday coming up, it's off for some training. Should take a couple of hours. I'll also be scanned and blooded and everything like that. And there will be a diagram drawn on me in permanent ink, which should last until the first blaze of treatment. And I've already been given 5 appointment slots for next year, all a day apart, where they will use this new Sabre radiation therapy on the site. It's not without its risks. If you get it wrong, obviously you destroy good tissue as well as bad. I have been told I may suffer damage to the upper bowel, duodenum, but I've been warned that I will suffer damage to one kidney. So that's something to look forward to.
Well, but you've got 2.
But I have to. I do have to. One can be thrown in the bin. But obviously, I'd rather that not happen. He's going to try and keep the damage down to a minimum, but the positioning of where the tumour is, and it's almost a perfect circle on the lower lobe. It can't help but pass through the tumour and contact the liver, which is a bit unfortunate. But the alternative, as I say, has got very, very little appeal. Apparently, the particular surgeon doing this, Dr. Falk, who I've nicknamed Columbo, can, in some cases, if that was the only tumour, the process is curative. But because it's so close to a blood vessel, there's only so much of it they can take, and it does have 5 or 6 brothers and sisters waiting in the liver. Small, sub 10mm areas of concern still in the liver. But as they grow and grow big enough to be of real concern, then they could also be sabred if good enough. Chemotherapy is not really an option. They would only consider chemotherapy after everything else has been tried, because with liver cancer, chemotherapy apparently isn't very effective.
Then there's no point in having it, is there?
Then there's probably no point in having it. For me to have that, there would obviously have to be great benefit compared to the damage and inconvenience it would do. So I'm not even considering that yet. I think that the main focus is to just get this Sabre out of the way. Wait a little while. They'll scan me regularly. I imagine it's going to be every 3 months now, and just check on its progress. That's all you can do. Once the big C decides it's taken a fancy to you, all you can do is play whack-a-mole with it, really. So this is a whack-a-mole with a huge prize, and no prizes for losing. So I don't think of any more things that are a problem at the moment. I think that's enough to be getting on with.
I think so too.
And we've just got to sit back and wait, and do as you're told, and that's it. That's the medical history in a nutshell. Case. Not case. So, yeah.
So we'll leave it there for now, and we'll do another video about what we've chosen to do, which is carnivore and fasting, and we'll let you know what's been happening to both of us, because I am going to do carnivore with him. I'm also going to do the fasting with him, so however long he has to fast for, I will also be fasting. So obviously we're looking for changes in both of our metabolisms, and we'll do another video quite soon to let you know how we've been getting on with that and what changes have happened or not. Okay, bye bye for now.
Cheers, see you soon. God willing.